Okay, I think it's all ready. It looks like we're on live. So does anybody want to start first?
One of you guys can go first.
Okay. Okay, well I'll just go ahead and go first. So I didn't go to the tour. I did the windshield activity. And after I read the email from the professor, and he said since I could just observe like my community, I live in Ankeny, so and I've lived here my entire life, so I did like an observation of around here, like I went to the library and stuff like that. Um, so I think, I don't know, I guess I'll just kind of read off of the survey, like the history. Ankeny is relatively new, so everything's pretty new. The only part of town that is like older is like the center part, which has been here for like 20 years. Otherwise, everything is really new, and the businesses are set up in the center. As far as like ethnicities and demographics, we are mainly like a white community. There are like, it's really limited. There really aren't that many different races and stuff throughout. It's kind of sad, but that's how it is. And we don't have any type of like different ethnicities of like grocery stores or anything. We just have like basic Mexican restaurants or like stuff like that. We don't have any. We really don't do. We really aren't set up for different ethnicities. And then for values and beliefs, we have so many different types of churches throughout Ankeny. There's Lutheran and Presbyterian and Catholic and assemblies, and usually it's the city that takes care of the like yards and the homes. And I asked about art on the survey, and there's art inside the churches. I think it's mainly private. Um, As for health and social services, we have a lot of Mercy stuff. We have Mercy North, which has an urgent care center, and I was under the impression that we had outpatient surgery services there, but I think they might not be true. Otherwise, we have dental offices and chiropractors and all that stuff, but we just have traditional healers. There's no like alternative medicine at all for the most part. I think one new clinic might be opening up in Ankeny that's alternative, but that's it. And then for the economic state of Ankeny, since we're a newer town, it's always growing. It's in a good economic state. It seems like it's in really good condition and stuff. And transportation and safety. Everyone has their own cars. We don't really have a bus system. There's one bus that can pick you up at in town, can take you into Des Moines, but other than that, there's no bus system. But people are pretty comfortable. You see a lot of people riding bikes around town, or even walking or rollerblading. And the communication throughout the town, we have an Ankeny newspaper, and then we also have an Ankeny magazine that goes out like with every season, letting the community know what's going to be going on that season and the different events and about sports and all those things. For education, the schools are in really good condition. They're expanding constantly. I'm sure you guys heard that Ankeny recently broke into, like, we used to be one high school and now we're two. So we have 8 different elementary schools, 3 different middle schools and 2 high schools, and they're all really new, so they're all in really good condition. And then we have lots of parks and pools and stuff like that for kids, and like a YMCA. So the strengths and weaknesses is that we have a lot of room to grow and we have a lot of money to grow and stuff, but we have lots of programs for kids and stuff, but I feel like it's not a very diverse community, and we could bring in more ethnicities and have more stuff like that. And then also, I did notice that, like, as far as healthcare, we don't have any free healthcare clinics in Ankeny at all, which would be probably a good thing to bring in or be around at least. But right now we don't. So as far as like the servant project, I don't really think there's a couple centers in Ankeny where you could do stuff, but I'm not really set on anything, I guess, or anything being in Ankeny. Okay, so that's all I have.
Okay. I can go next.
Okay.
Okay. I live in North Liberty, and I've lived here for about 3 years now, and it's just a suburb of Iowa City. But through my observational experience, um, the most of the homes, buildings, and apartments that are around here are fairly new, um, because North Liberty, kind of like Ankeny, is like a fairly new town, um, and it's been growing pretty rapidly for the past 10 years. For ethnic or demographics, a lot of the people that live here are like younger adults, like 25 to 35, and for the most part, like Ankeny as well, it's mainly like a white community. There's not much diversity here either. Um, we don't have very many ethnic grocery stores. Actually, we don't have any. We have is like a Fairway, and they're building a Hy-Vee right now. But we do have like a whole bunch of different types of restaurants. Like we have some Mexican restaurants, Chinese, and a couple of Italian restaurants. Um, for values and beliefs, there's a whole bunch of churches here too. Altogether, we have 6 of them. There's a whole bunch of Christian churches, Lutheran, Presbyterian, Baptist, and Methodist. Um, uh, how are the homes and yards cared for? A lot of the homes around here are like condos or townhouses, so um, they're maintained by like associations and stuff. And for values, I noticed that, well, what I take from it is that our community values family, because we have a whole bunch of different schools and daycares and stuff available for families here. Um, the physical environment, I would say North Liberty is pretty well kept and clean. I think for the most part, when people come here, they realize that it's a newer community, and it's. I think people get like a homey feel here. Um, uh, Community aesthetics, I would say that the streets and parks and yards are pretty well maintained, and I noticed that they started putting in some trees and stuff just to make the town a little bit more appealing, I guess. We have a couple of clinics here. We have a U of I Quick Care and a Mercy Care clinic, which is also an urgent care. We have a Mercy Family Health Center, and we have like chiropractic clinics, massage therapy clinics, acupuncture, and stuff like that. Um, a lot of the transportation, since we're like a smaller town, a lot of people just drive their own cars, and we have a whole bunch of trails too that people like to use to go biking and stuff like that. And we also have a bus route that goes from North Liberty to the Iowa City and Colville area, which is kind of nice for people that need transportation over there, I suppose. Um, I'd say that that it's a pretty safe community here. Overall, there's never any like crimes or anything that I've ever heard about that are happening in the community. Um, we also have like our own community newspaper called the NOJOCO, which stands for the Northern Johnson County, which kind of just informs the community of any local news and what's going on in the area. There's also a whole bunch of schools here. We have many elementary schools. We actually have 4. We have a Christian school, a couple of preschools, and we have 4 daycares. Um, we do have a library, and our library is actually part of our community center, which includes uh, an indoor and outdoor swimming pool, a track, a couple of gyms, aerobics rooms, conference rooms, and stuff like that. So there's a lot of things that you can do there. And for strengths, weaknesses, and areas of concern, I would say that our strengths are that we're a safe, clean, rapidly growing community. I think weaknesses would be there's not a lot of shopping or entertainment centers like around here, so you have to travel out of town for that. Areas of concern, I wouldn't say there's much. I mean, we're still growing, so I don't know. But that's all.
Yay!
Okay, so I went on the River Bend tour that was offered on Monday. So I didn't go through my town or anything because I live in Altoona. But basically, what the River Bend tour was is we met up and um, started at the Salvation Army Corps, and we kind of just started with some facts about the neighborhood itself. So the River Bend neighborhood is literally down 6th Street past the hospital. And according to the Census Bureau in 2013, Riverbend has a 40.1% of their residents living below the poverty level, with a population of almost 1,300 people, which is actually considered one of the highest, except for an Ottumwa district that has a 42% below poverty level, but their population is less than 500. So it's kind of skewed. Um, but it's way higher than any poverty level in all of Des Moines, which is at 11, and then Iowa overall is at 9. So clearly, based on the numbers, we already knew that it was a pretty underserved community to begin with. When you first come into Riverbend, I don't know if either of you have been there, it pretty much shows right off the bat that it's a community that's in need. Once you kind of get past the hospital, you start seeing a lot of houses that have boarded up windows or cracked glass and doors, a lot of trash, broken sidewalks, condemned buildings, and so right off the bat you kind of just, it's a little shocking thinking that we literally go to college a couple blocks away and you've got that big hospital right there too. So we walked around and visited a bunch of the different um, groups that have already been contacted that we can do work with. We got a great big list from Dr. Moravik, and some of them are already pre-planned servant leadership, I guess, projects that we can do. And so it's kind of nice. I've got the list, and I can email it out to everybody. But
Is that the same list that he posted online?
I didn't look. I would think so. But it is, there's a food pantry, a community youth concepts, children, family, urban movement. We actually went to that one. It was held in a church right across the street from the elementary school that's there. And they're not affiliated with the church. They just use it kind of like as a safe haven since it's right across the street from the elementary school. This one was really cool, and I found it pretty interesting, and everybody we met there was super nice and into what they were doing. They have a breakfast club in the morning for the kids. They can come in starting at 6 o'clock. And until school starts, they serve breakfast, help them with homework, read, play games. And then after school's over, they walk the kids back over, and they have kind of like after-school projects, fun games and everything, help with homework. And then they also serve dinners as well. So that was one that we actually got to go to. We were there at the St. Vincent de Paul, which is, oh no, that wasn't it. U.S. Committee for Refugees and Immigrants. They bring in anybody who is trying to escape somewhere outside of the United States due to either poverty or war, and they help bring them and associate them to the area, get them a home, and pretty much pick them straight up off of the plane and help them get adjusted. So that was pretty cool. We watched a video on Joppa, which goes around to the Riverbend area, actually down by the river where there's a lot of people who are homeless living in tents. And they bring food and supplies to them every week. And then we started at the Salvation Army, and they serve as a food pantry or somewhere where you can go and get help for like rent and things like that. So those were some of the bigger ones that we kind of hit. There's that huge list of already pre-made ones, I think, online. Otherwise, I have it that gives like an outline of all the rest. But so it seems like there's things in the community that are trying to help at least make a dent in it. But the community itself, all the homes and businesses are really old and haven't really been updated. It seems like the populations are pretty dominated by African Americans and Asian Americans. I think because we actually walked the neighborhood because it was a nice day, and for a while there it seemed like there weren't very many Caucasians or any other kind of ethnicities once you got past the hospital. There weren't very much in terms of like grocery stores and things like that. There were little small businesses like auto bodies and places where you can get your hair cut. You had to go back up towards the hospital in order to hit like a Walgreens and a McDonald's. There were a lot of churches from what we could see, a lot of smaller churches and a variety of different types of religions that they were serving. But there weren't necessarily any public signs or values that were out besides just the churches. There was one piece of art. I don't know if anybody's seen it, but it's like a sculpture. I think it says "Think," but it's filled with plastic bags. So I don't know if it's actually art or something they're doing to collect the bags to save them. I don't know. But overall, the community itself was fairly, I want to say in shambles, because a lot of the houses were boarded up. Every single sidewalk was cracked or like so thin you had to walk single file on it. The only health care that was around there was the hospital pretty much, and you either had to walk or take the DART up there. And obviously the hospital is really nice, but not everybody can get there or afford it. And the evidence of the economy down there is, I mean, it's pretty negative. There were some Habitat for Humanity homes that were being built or had just been built that were pretty nice, but there was no real evidence of any kind of like economic growth or community growth. Dr. Moravik was talking about the safety down there, and he said on a good day, if you're walking in a big group, it's pretty safe. If you're walking on your own, though, kind of late at night or early in the morning, he said it probably wasn't the best of places to be walking. And there were 3 girls that were on this trip, so he said probably for us it wasn't the best. But it didn't seem like we were in any danger at any time. We did feel, or at least I felt like I was being watched. Because here were 4 people just kind of walking around town, not really doing anything. They're just chatting about the town and stuff. But there wasn't really any communication posted, newsstands. It didn't seem like there was a newspaper or anything that kind of went around. There was anything that was like associated with the church or a foundation that was trying to help or serve was posted on their building itself, but nothing newspapery. Didn't see very many children except for at the school, and so I didn't really. It seems there's a good school there. It looked like it had just been done, but it's an extremely old building. And it was actually the school apparently that Hillary Clinton was at the other week. Didn't see a library except for the one that was in the school, and I didn't really see much in terms of where children can play or families could hang out unless it was like in somebody's yard. So overall, the community itself, the strengths, I think like there are things there that are trying to like build it back up or help at least with the poverty and economic status, but it's not really making the big enough impact that I think everybody'd be hoping for. And the weaknesses and concerns for the community, obviously the fact that it is in such disarray that it is considered below the poverty level at such a great number compared to the rest of Iowa. And you didn't really see anybody out and about doing anything unless they were living there and like sitting on their front porch. There was no action taking place. There was no help, anything like that. And the only government help it seemed like was any Section 8 housing. So the community itself just isn't growing. So clearly it is somewhere that needs assistance and service. So that was pretty much it.
So, do you have like any idea where, like, well, actually, first of all, Melanie, do you come into Des Moines like at all for classes, or do you stay at North Liberty?
Oh, I'm the one that lives in North Liberty.
Oh,
Yeah.
But no, everything I do is online.
Everything you do is online. Okay. Well, I mean,
So
I
he
think
talked about that, though.
Yeah.
Dr. Moravik said that if there's somebody who doesn't actually come to the school for class, as long as they do a project that is similar, so like he used the Children and Family Urban Movement as an example, and said that if only 2 of us actually went to CFUM and worked, as long as Joanna would do something that involves children, he would still count that as okay with the group for our project. I think we'd have to get a little bit more specific on it
well,
with him, but
do you
said-
have any idea, Brittany, right? Sorry, I'm like really mixed up on names. Brittany, do you have any idea like where you could volunteer like in North Liberty at all?
Yeah, we have a community like food pantry place that I was looking into.
Yeah.
Yeah, I was pretty interested in that.
Okay. Well, I feel like I don't know what you guys feel like, but I feel like you might be a little bit like have like a little bit more like limited like on like places you could volunteer. We probably have like a ton of options in the
Yeah.
so we may have to like go a little bit more based off of like what you can like kind of do. So you'll have to kind of like I don't know, me look into us and look into it and let us know because I mean I'm not super picky. I kind of was thinking about working with kids too, but I mean I'm totally open to whatever. It doesn't really.
Okay, yeah, I'll look more into it and see like what else is available around here because all I found so far is just that community pantry. But I'm sure I could search more into it and hopefully find more around here.
Does the library have anything like community programs, children's programs, or things like
I
that?
actually think I did see something about that. So,
because I don't know like how closely related they have to be, because obviously what your community is serving is going to be way different than what River Bend is going to be serving. So I think there has to be some give and take on that. I was really interested in the Children and Family Movement, the one that did the Breakfast Club and after school programs. It seemed like one that had been established and was really making the biggest difference from what I could see in the like 30 minutes we were there. I myself am going to be limited based on my class schedule and my work schedule, hence why we couldn't do this until 8:30 at night. Usually I don't get off until 9 o'clock. So I can see what else I could do, but I can't change my work schedule. That's something I just have to work around. I mean, there is the food pantry on here, but from what I understood, they didn't really take that many, and the number of hours you do on like one block isn't very many, so you'd have to go for like 2 weeks, which isn't necessarily a bad thing, but we all have to be able to make that kind of commitment.
Yeah. Yeah, I myself would probably be more interested in like I don't have a super tight work schedule, but I have kids in like the class schedule, so like something for me like it'd be ideal for me to do like a like shorter amount of days with like longer hours. I know like, like where I have like an 8-hour period where I can really give myself to it or something because I don't know if I can go like weeks at the same time because my schedule is just not that constant. But
it seemed like most of them didn't offer anything more than 2 hours at a time.
More than 2 hours? Okay.
Yeah. So like the Seafoam one with the kids was pretty much from 6 in the morning until like 8:30 when we walked them across the street. And then the after school thing was only for like an hour or two. So, and then the other ones, food pantry, they limited because usually they get a lot of volunteers in there because food pantry is usually a big deal.
I actually think that now is a really bad time actually for the food pantry because I went to church this weekend and and went to a Lutheran church, and they actually this entire month are giving, like, for Super Bowl, they're like working at the Salvation Army food pantry. Like, they were just talking about it this Sunday, so it's really funny that you guys went on that, because they were just talking about how they're going to all be working there, like, this month. So I bet they are kind of limited.
Yeah. There was a lot on the list that we didn't necessarily touch on, and I guess we'd have to go to their websites or ask the professors a little bit more.
I looked at a Yes. I don't know if that's on the list. It's like
Yeah.
Yes.
Yeah.
It's like another children. It's like an emergency shelter for infants through 17, and it's just like a shelter house for any child, anyone under 18 from any age, where they can, like, they have like I watched like a YouTube video. They have a certain, like, amount of beds there, and people can stay there, and, like, I don't know, I might do some research on them, but otherwise, like, the before and after school one that you talked about, that one sounds really interesting, and I don't think it would be, like, would that work for your schedule to go at 6 a.m.?
Yeah, I could do that, honestly, and I would be more than willing to do that one and wake up that early, because the people there, the guy that actually runs the Breakfast Club is actually a student at Mercy who had taken this class, loved it so much that he just continued to volunteer there, and then after 4 months they offered him the job.
Oh, that's really inspiring.
So, obviously they're doing good work that, it made such a great impact on somebody from this class.
Mm-hmm.
But I'd be willing to do that. I think we do have to talk with the professor, though, to say that only 2 of us would actually be doing the project here in Des Moines, and then we'd have to explain what Joanna would be doing where she lives. Just so that he's on the same page and, like, is okay with. And obviously, they can't necessarily get upset with the fact that she lives all the way out there and can't come here to do the project. So they have to be lenient about it. But, yeah, so I think we have to turn in our, like, proposal. I think it's next week or so. Mm-hmm. They said the sooner the better once it's posted.
Mm-hmm.
So,
well, I mean, we kind of have I think they're going to post it. I think he posts on Monday for week 5. So we kind of have the weekend to, like, kind of, I can email you guys and kind of keep in contact and, like, figure out, like, an exact plan. But that would probably work really well for me, as far as me and you doing the 6 a.m. thing, because I don't know, I would be willing to do that, and that would probably be fine. But if you, Brittany, want to look into what's around your community and, like, kind of let us know, and one of us, if you want to contact, or we can all, like, we can do a group email, I guess, with a professor or something, and just kind of let him know what's going on, I guess. I'm sure he'll understand.
Right. That sounds good.
Okay.
Do we want to email the professor before Monday then?
Yeah.
And then just forward whatever he says on to everybody else if you do it individually, or send it as a group. I don't care. He didn't really say, like, what to cover, I guess, when it's in that situation. He just said if it comes up, we'll be willing to work with you guys on it. So.
Okay. Yeah, I can probably email him, and I'll just put you guys on. I'll just do a group email and put you guys on it and just kind of explain, and we can figure it out.
Okay. And then you've been recording all this?
Yes, I have. It's all recorded, and I think in the end, after this, I have to click, like, stop broadcast, and then it's gonna add, like, it's gonna give me a link, and then I think I need to test the link, and then I upload it to the Dropbox.
Okay.
But it should work just fine.
I'm glad you know what you're doing, because I don't.
Right. It was really confusing for a second there. I was like, ugh.
Like, I logged in the other day, like, trying to figure out how to get to Hangouts and use it, and it's like, you have no friends, and I'm like, oh, well, that's really sad, but I still don't know how to use you, so.
I know. It's really, this is the first class that I've ever had to do this for, so this is, like, completely new to me. I have no idea what I'm doing, but it seems to be working okay.
Okay, so then you'll post the link, and only one person has to do it, right?
Yeah. I think the captain does it usually.
Yeah, I think that it like specifically says that.
Okay.
Yeah, but I mean, yeah, okay. Well, I know that we didn't really meet completely the 45 minutes, but I feel like we've covered, like, does anybody else have anything that they want to share or anything?
No, I think we've got a good plan, and once we hear back from the professor, we can really make a decision about what we want to do, and it sounds like you and I are at least on plan with the morning program with the kiddos,
Okay.
so that should be
Yeah, you'll
good.
just have to let us know, Brittany, about what you find.
Okay, I will. I definitely will do that.
Okay.
Perfect.
All right,
Well,
ladies,
you guys
have a
have
good
a
night and
great
a
evening.
closeness and everything. Yeah. All right.
Do you want to copy the link though and an email to us just so we have it?
Yeah, sure. Yep, I will. I will do that. I will copy it and send it to both of you guys. Okay.
Okay.
Okay. Right.
Perfect.
Okay. Bye.
Bye.
Bye.